I'm Craig Cole. I'm from Carmanos Cancer Institute in Detroit, Michigan, and Michigan State University in Lansing, Michigan. And I'm here at the International Myeloma Society meeting in 2025. And I had a poster that addresses some things we found with the NCCN guidelines. So the National Comprehensive Cancer Network guidelines are the guidelines that doctors around the world use to help them treat multiple myeloma, diagnose myeloma, and what to do with relapses. Those recommendations are based on papers and research that's been done over the decades to help support the recommendations of what to do. What we looked at is we were curious about what was the representation of Black patients in those recommendations, because we know that myeloma is twice as common in people of African descent than in Caucasians. We know that about 22% of myeloma patients are Black, and if you're making guidelines that are representative, then you would have to wonder, are the guidelines applicable to everybody? So we went through basically the entire over 400 of the papers cited that support the National Comprehensive Cancer Network guidelines. And then we looked at how many of those actually mentioned race in their paper, and how many mentioned, the ones that did mention race, how many Black patients were supported. We found that most papers didn't mention race. However, as time has gone on, from the 1990s up until today, the reporting of race has become more and more common. Super good news there. The number of Black patients represented in of the papers that had race mention, the number of Black patients involved in those trials is about 7.8%. So it's not as representative as we would like. However, the fantastic thing is that we let the NCCN body know that there was underrepresentation of Blacks in those trials. And so in the NCCN guidelines today and moving forward, it has a little footnote that says, that we need to include more minorities and more people of different races and ethnicities in clinical trials, and that we really do need to discuss, as we would anyway, the recommendations with our patients. So the NCCN was aware of what we found and then has made changes in order to facilitate better representation in their guidelines.